If you have ever stood in your kitchen in the morning trying to decide between eggs and oatmeal and genuinely not known which one is doing more for your blood sugar, you are not alone. This is one of the most common questions I get from patients managing prediabetes or type 2 diabetes. Both foods have been called healthy for decades. Both have passionate advocates in the nutrition world, and the advice has flipped so many times over the years that most people have simply stopped trusting any of it. Today, I'm going to end that confusion. Not with opinion, not with dietary philosophy, but with the specific metabolic science behind what each of these foods does inside your body within the first 2 hours of eating them. By the end of this video, you will know exactly which one to choose, when, and under what circumstances each one either helps or hurts your blood sugar. And the answer is more nuanced than most people expect. My name is Dr. Stephen Moss, and I want to frame this conversation the right way before we get into the comparison, because framing matters here. This is not a question about which food is healthier in some abstract, general sense. This is a specific question about glycemic response, insulin demand, and the downstream metabolic consequences of eating each food in the context of blood sugar management. Those are precise biological questions with precise biological answers. Let's start with the basics and build from there. Eggs first. A whole egg contains 0 carbohydrates. 0. There is no glucose in an egg, no starch, no sugar of any kind. The macronutrient profile is entirely protein and fat. Approximately 6 grams of protein and 5 grams of fat per large egg, distributed between the white and the yolk. From a pure glycemic standpoint, this means that eating eggs produces no direct glucose entry into the bloodstream from the food itself. There is no carbohydrate to break down, no glucose to absorb, and therefore no insulin spike triggered by the food's own composition. If you eat 2 eggs for breakfast, your blood sugar will not rise as a consequence of the eggs themselves. That is not a conditional statement. It is a biochemical fact. The glycemic index of eggs is effectively 0 because they contain nothing that converts to glucose during digestion. But the story goes deeper than 0 carbohydrates, and this is where eggs become genuinely interesting from a metabolic standpoint rather than simply neutral. The protein in eggs triggers a moderate release of insulin, significantly lower than carbohydrates produce, but present. That protein-triggered insulin response, however, is accompanied by something carbohydrates do not bring. Protein and fat together slow gastric emptying substantially, meaning that anything else you eat alongside eggs moves through your stomach into the small intestine more slowly. The presence of fat and protein in the digestive system at mealtime functions as a natural brake on the absorption of any carbohydrates consumed in the same meal. If you eat eggs alongside toast, the eggs are actively moderating the glucose impact of the toast. This is not a minor effect. Research published in the American Journal of Clinical Nutrition found that adding protein and fat to a carbohydrate-containing meal reduced the post-meal glucose peak of that meal by up to 40% compared to eating the carbohydrates alone. Eggs are not just glycemically neutral. In a mixed meal context, they are actively protective of blood sugar stability. There is also a satiety dimension that has direct metabolic relevance. Eggs are among the most satiating foods per calorie studied in nutritional science. Research from the International Journal of Obesity found that individuals who ate eggs for breakfast consumed significantly fewer calories over the subsequent 24 hours compared to those who ate a calorie-matched carbohydrate-based breakfast. The mechanism involves the sustained elevation of peptide YY and GLP-1, gut hormones that signal fullness to the brain, which protein and fat trigger far more powerfully than carbohydrates do. This is metabolically relevant beyond just weight management. When satiety is sustained, the mid-morning hunger that typically drives people toward high-carbohydrate snacks is suppressed. The second and third glucose events of the day are moderated by how well the first meal held the line. Eggs hold the line exceptionally well. Now, there is one conversation about eggs that I need to address directly because it has created more unnecessary confusion and fear around this food than almost any other nutritional topic of the last 50 years. The cholesterol question. For decades, dietary cholesterol in eggs was blamed for raising blood LDL cholesterol and increasing cardiovascular risk. That claim drove an entire generation away from egg yolks. The science has since been substantially revised. The current understanding, supported by multiple large-scale meta-analyses, including research published in the British Medical Journal and the American Journal of Clinical Nutrition, is that dietary cholesterol has a minimal effect on blood LDL cholesterol in most people because the liver compensates by reducing its own cholesterol production when dietary intake rises. The primary drivers of harmful LDL elevation are saturated fat from ultra-processed sources and trans fats, not whole food dietary cholesterol. For most people without a specific genetic condition affecting cholesterol metabolism, 2 to 3 whole eggs per day is not associated with increased cardiovascular risk. The egg white-only approach discards the yolk, which contains the majority of the egg's micronutrients, including choline, vitamin D, B12, and lutein, based on a concern the research no longer robustly supports. Eat the whole egg. Now let's talk about oatmeal, and I want to be precise here because oatmeal is not a single food. The word oatmeal covers a range of products with dramatically different glycemic profiles, and treating them as equivalent is one of the most common errors in blood sugar management. On one end of the spectrum is steel-cut oats, sometimes called Irish oats, which are whole oat groats that have been cut into pieces with a steel blade. The grain's physical structure is largely intact. On the other end is instant oatmeal, which is oat groats that have been rolled flat, pre-cooked, dried, and processed into thin flakes that rehydrate in minutes. The carbohydrate content of these two products is nearly identical. The glycemic response is not. The glycemic index of steel-cut oats sits between 42 and 55, which is in the low to moderate range. The glycemic index of instant oatmeal sits between 65 and 83, which is in the high range, comparable to white bread in many measurements. The same oat, processed differently, producing a completely different blood sugar outcome. The reason is structural integrity. When you eat steel-cut oats, the physical matrix of the grain requires significant digestive work before the starch inside can be accessed and broken down into glucose. That process takes time. Glucose enters the bloodstream gradually. When you eat instant oatmeal, the processing has already done most of the digestive work for you. The starch is exposed, the particle size is tiny, and the enzymes that convert starch to glucose have almost nothing standing in their way. The glucose arrives fast, and it arrives in volume. Research published in the Journal of Nutrition and Metabolism found that steel-cut oats produced a post-meal glucose peak approximately 29% lower than instant oatmeal made from the same oat variety. That difference is entirely explained by processing. The oat is not the problem. What has been done to the oat determines whether it helps or hurts your blood sugar. This distinction is the most important thing most people with diabetes have never been told about oatmeal. There is a second factor that determines whether oatmeal helps or harms blood sugar, and it is almost universally overlooked: beta-glucan. Oats are one of the richest dietary sources of a soluble fiber called beta-glucan, which forms a viscous gel in the digestive tract when it comes into contact with water. That gel physically traps glucose molecules and slows their absorption across the intestinal wall. Beta-glucan is the primary reason that oats have been studied and confirmed to improve insulin sensitivity and reduce post-meal glucose response over time with consistent consumption. Research from the European Journal of Clinical Nutrition found that 3 grams of beta-glucan per day, achievable with a single serving of oats, significantly reduced post-meal glucose and insulin responses in adults with type 2 diabetes over a 12-week period. But here is the critical nuance. Beta-glucan content is substantially reduced in highly processed instant oats compared to steel-cut or rolled oats. The processing that makes oats cook faster also degrades the fiber structure that makes oats metabolically beneficial. You are paying the full glycemic cost of oat starch while receiving a fraction of the beta-glucan benefit that justifies it. That is a bad metabolic trade. Now let's put them side by side in the context of blood sugar management specifically, because this is what you came here to understand. In a head-to-head comparison for someone whose primary goal is minimizing morning glucose spikes and reducing insulin demand, eggs win clearly and without meaningful qualification. The glycemic response to eggs is 0. The satiety is superior. The effect on subsequent meal choices is protective. There is no version of eating eggs that produces a blood sugar spike from the eggs themselves. For anyone in the pre-diabetic range, anyone with type 2 diabetes, anyone whose fasting glucose is creeping upward, or anyone who experiences significant energy crashes mid-morning, eggs are the mechanistically correct breakfast choice from a pure blood sugar management standpoint. However, the honest clinical answer is more complete than that. For someone who is metabolically healthy with good insulin sensitivity and no blood sugar concerns, properly prepared oatmeal, specifically steel-cut oats prepared without added sugar and eaten alongside protein and fat, is a nutritionally valuable breakfast with documented long-term benefits for cardiovascular health, gut microbiome diversity, and sustained satiety. The beta-glucan in steel-cut oats feeds beneficial bacterial populations, including Akkermansia muciniphila, that support insulin sensitivity over time. The fiber supports bowel regularity and reduces LDL cholesterol through bile acid sequestration. These are real benefits. They do not disappear because eggs are better for acute blood sugar management. The two foods are not competing for the title of universally superior breakfast. They serve different metabolic contexts. The nuanced clinical answer I give my patients is this: if your blood sugar numbers are already in a concerning range, if your fasting glucose is above 100, if your post-meal energy is unstable, if you have been diagnosed with prediabetes or type 2 diabetes, eggs are your morning foundation. 2 to 3 whole eggs prepared without refined oil, with vegetables added for micronutrient density, is the most metabolically protective breakfast you can eat. If you want to incorporate oatmeal, add a small amount of steel-cut oats alongside the eggs rather than replacing them. The protein and fat from the eggs will blunt the glycemic response of the oats. You get the beta-glucan benefit without the unmoderated glucose spike. If your metabolic health is currently good and your goal is maintaining it rather than reversing damage, alternating between eggs and properly prepared steel-cut oatmeal is a reasonable and evidence-supported approach. Add protein to every oatmeal breakfast without exception. A scoop of plain Greek yogurt stirred in after cooking, 2 boiled eggs on the side, or a tablespoon of almond butter mixed through. Never eat oatmeal alone. In the absence of protein and fat to slow gastric emptying, even steel-cut oats will produce a more aggressive glucose response than they would in a mixed meal context. And regardless of which you choose, the preparation decisions matter as much as the food itself. Eggs cooked in refined seed oils carry inflammatory compounds that offset some of their metabolic benefit. Cook them in butter, avocado oil, or extra virgin olive oil at lower heat. Oatmeal topped with brown sugar, honey, dried fruit, or flavored syrups becomes a glycemic event regardless of what the oat variety was. Top it with berries, cinnamon, nuts, and nothing else. The answer to eggs versus oatmeal is not a single winner. It is a context-dependent clinical decision. But if you are sitting in front of elevated blood sugar numbers right now, and you need to make one change to your morning that will produce a measurable difference within 2 weeks, that change is switching to eggs. The biology on that recommendation is unambiguous. Both foods have earned their place in a metabolically informed kitchen. The question is always which one belongs in your kitchen right now, given where your numbers are and what your body is asking for. You now have everything you need to answer that question for yourself. If someone you know is confused about what to eat for breakfast while managing their blood sugar, share this with them today. That confusion has a clear answer and they deserve to have it. I'm Dr. Stephen Moss. I'll see you in the next one.